Hello, I'm Jim Hyland, president of OraVital. I'm a dentist, and I was the first person to use the OraVital system that Ann Bosey introduced me to back in about 2008. Ann had developed a system for treating breath odor, and she told me she had a 90% success rate in treating breath odor. She told me at the same time that the same bacteria that cause gum disease cause breath odor, and when she mentioned she had a 90% success rate, I asked her what happened to the gums. And Ann told me that they got very healthy very quickly. And I suggested that that should be the type of focus I'd like to introduce into my practice, that while it was important to be able to treat breath odor, treating gum disease was a much bigger concern and more to do with the oral health that I was trying to focus on. What I want to do today is discuss the opportunities in dentistry to promote this disruptive technology that is unique to OraVital. I'd like to present the problem, why change is needed, and what needs to be done, and how OraVital offers the best and for now the only solution to this problem. Let's start with the fact that 75% of people have gum disease in spite of the fact they see their dentist on average twice a year. Now if you were choosing a lawyer and the lawyer lost 75% of their cases, you wouldn't go and see that lawyer. So how come so many people have gum disease defined as the tissues bleed when they're touched in spite of their care they're receiving? It's because we tell people to brush their teeth. They should be brushing their gums. We tell people to floss their teeth, but when you floss the tooth, you're flossing a convex surface. That leaves a concave surface, so there's the tooth, there's the gum, and that's the shape of the gum tissue. And I ask you, can you floss the inside of the bowl? And most people will say no, and you're right. So when you floss your teeth, you do not clean the gums. Then we tell you to have your teeth cleaned. And while having the teeth cleaned is important to get rid of stain and calculus, it does not treat the bacteria that cause the disease. If you don't treat the bacteria, the disease goes untreated, and you're treating the symptoms, you're not treating the cause. If you see a physician before they give you an injection, they disinfect. Before you have surgery, they disinfect. But in dentistry, we use the same instruments that are sterile to begin with. From disease sites to healthy sites, we actually spread the infection in doing that. And finally, if you went to see your physician and they told you that there was blood in your urine, but not to worry about it to come back in 6 months, I think you'd find a new physician. And yet routinely in dentistry, at the end of a visit, if you spit blood or there's blood on your toothbrush or when you're cleaning your teeth, we would tell you not to worry about it, to come back in 6 months. That's relatively normal. And then when it gets really serious, we'll tell you that it's time to go and see a gum specialist to have your gums amputated and your teeth amputated. And at that point, we'll take the problem seriously. So what's changed now is that there's a recognition that what happens in the mouth doesn't stay in the mouth. An article was published by Dr. Bale and Doneen in the British Medical Journal in November. What they said was that gum disease bacteria, the high-risk pathogens, cause atherosclerosis. And in their individual studies, they say that 50% of all heart attacks and strokes are actually caused by gum disease bacteria and the inflammation that they cause. When you have an infection in your gum, it travels through the bloodstream, the bacteria, 24 hours a day, 7 days a week, 365 days a year for decades. And so a small amount of bacteria cause a problem, not the severity of the disease, and this is a new concept. The second thing is that Michelozzi did a study on the brains of 1,453 Alzheimer patients, and what she found was those brains looked identical to the patients that had syphilis and Lyme disease, and all those diseases are caused by spirochetes. And so we think that Alzheimer's is now considered to be a spirochetosis, an infection of the brain with oral spirochetes. When you take a look at cardiovascular disease, rheumatoid arthritis, and Alzheimer's as being potentially related to oral diseases, I think you understand the impact of how our failure to control this infection is having a serious impact on patients' overall health, never mind the dental concerns that occur. Once we understand that, particularly with heart disease, that heart attacks could be prevented, and we know how serious they take high blood pressure and cholesterol, we have a fiduciary duty now to inform and treat patients. It's a medical problem with a dental solution. We need to treat it as an infection, not treat the causes. The existing solutions don't work. So how do we accomplish that? When you're taking care of a patient, you have to motivate and inspire them to take care of their mouths. You have to teach them methods that actually work. And you have to create an environment that they can clean and maintain however it's done. To do that, we have to talk about this oral systemic link. We have to do what we call an emotional exam. And we have to talk about the fact, I don't know if you know this, but gum disease is a kissing disease. It's spread through kissing, it's contagious, infectious. And if you have gum disease, you're actually sharing with the ones that you're closest to. Michelozzi talks about, and so does Bale, the fact that we need to test for these bacteria. And that can be done with the DNA test, and OraVital offers a DNA test. Ours is unique. The other two competitors on the market use a saliva test. Saliva is affected by what the patient did before they came in. If they had an alcoholic drink, if they used a mouthwash, if they cleansed their mouth really well, if they ate and drank before they came in, you're going to change the saliva and the composition of the saliva. It's an indirect measurement of the bacteria under the gum tissue. It's actually measuring a whole mouth biofilm, and it is what we want to do, but ultimately in a different way. Another method is to use paper points to go between the gum and the tooth. This is done by another competitor, and it's a very accurate method of measuring under the gum. What we did was we wanted to get a whole mouth biofilm, because when you treat the gums alone, you don't kill the bacteria that are at the back of the tongue, the throat, the tonsils, and as such, patients reinfect themselves. And this is another problem in dentistry. We don't control the whole mouth biofilm. So what we did is we took a little pad that goes to the back of the tongue, at the throat, wipe forward, dip it in the saliva, rub it against the tongue side of the teeth, and then take paper points and put between the gum and the tooth, and we get a whole mouth analysis of the supragingival, subgingival, saliva, and at the back of the throat and tongue. With that, we're able to tell the type of pathogens that are present, not only for gum disease, but for yeast and for decay. To treat this now, most people do not want to use oral antibiotics, and they do not want to use oral antibiotics because of the systemic effect. There's a concern about autoimmune diseases being triggered with oral antibiotics, and the antibiotic that we like to use causes a lot of problems. They can't have a drink with it. It's called metronidazole. So rarely is this drug used for an oral intake as a pill because of the systemic effect it has, and yet it's the most effective drug, so we use others that aren't as effective because we want to avoid the side effects. What Anne discovered was that if you were to basically take the pill and open it up and put it on your tongue as a powder and rinse and spit, you would have 3,000 times the concentration of antibiotic, and in doing that, you would be able to wipe out the biofilm throughout the entire mouth, and since it's particulate, it gets between the gum and the tooth up to 6 millimeters in pockets. And so now you have a delivery method of an antibiotic that is safer, does not cause systemic effects, treats under the gum, and in fact treats the entire mouth. So as such, a rinse delivery system is far superior to oral pills for gingivitis, mild to moderate perio, even for severe perio, but for severe periodontal disease, you probably would combine it with an oral antibiotic to sandwich the bacteria from within and without. So we have a therapy then that can treat breath odor, and if you think about it, tonsillitis and strep throat are surface infections at the back of the mouth. We have, our system has been just patent pended, so that we are able to control the use of a combination of using a test to test the bacteria, a DNA test, with a combination of antibiotic rinses that you have to use. We've started guaranteeing that with this treatment will give the results that was found in Anne's study, where she treated 649 patients, and she was able to show an 87% reduction in bleeding on probing, and an 84 to 79% reduction in pocket depth in 2 weeks. Listen to this, with no scaling, because if you kill and control the bacteria, you actually kill and control the disease. So we have a system then that's unique, that treats gum disease, breath odor, oral infections in the mouth, addresses the oral systemic link, and it's something that all dentists, physicians, and vets can use. It will become the standard of care. We're the sole provider. That's what OraVital is about. Thank you very much.